Today's Profiles in Plutocracy. We'll be talking about Jeffrey Romoff, who's the CEO of the University of Pittsburgh Medical Center, which is the largest nonprofit hospital in the United States.
And nonprofit means good.
Exactly. And also the CEO compensation is the highest CEO of probably any hospital. It's $5,975,000.
Good Lord, that's a lot of money.
In 2012, they spent over $1 million in lobbying fees and donated over $150,000 to Obama and Romney, but mostly to your man Obama. So
who is that again that donated to my man Obama?
University of Pittsburgh Medical Center.
All right.
And so yeah, it's run right now by Mr. Romoff, who's for many years has had the highest CEO pay of any nonprofit in any hospital, any medical center in the country.
Any nonprofit and nonprofit hospital?
I'm sure. How is somebody in a I almost guarantee it.
Yeah.
Who's gonna make $7 million in a nonprofit?
Yeah.
Find me that motherfucker.
All right, that's
anyway,
a good point.
He started at University of Pittsburgh in 1973 as a director of the Office of Education and Regional Programming for the Western Psychiatric Institute and Clinic, and then moved to Health Sciences at the University of Pittsburgh, and in 1992 became the president of UPMC. In 2006, became president and CEO. Now in 2008, so this is my question. If these people need this money for innovation, why do they keep spending it on my government? 2008, Romoff donated over $14,000, mostly to Democratic candidates. He voted $5,000 for Obama's victory fund so we could put in Obamacare. Recently, actually, the UPMC's nonprofit status has been challenged by Pittsburgh mayor, who just put this in, who's, I guess, going forward with a suit in court. They say that UPMC doesn't meet the HUP test, which is a 5-point test that Supreme Court decided on last year, that nonprofits have to meet certain criteria to supposedly be a nonprofit, and so according to their lawyer, they're not going to meet it. And the reasons they cite are fail to provide sufficient charity donations. They operate they have two company jets, two corporate jets. Why do you need two corporate jets?
For one hospital.
Why do you need a luxury headquarters? With a private chef, a chauffeur, a private dining room? 20 employees are paid more than $1 million.
I mean, is that what they take fundraisers to when they're trying to raise money for the hospital? I don't know. I don't know why they do that. But hey, I mean, if it's wrong, then it's a good thing the government should do something about it.
We'll see what happens in court, and yeah, well, maybe we'll see if they lose their nonprofit status.
I bet Obama will do something about it.
Yeah, maybe he'll step in for his buddy. He'll be like, "Hey, Obama, remember that $5,000 I dropped you in 2008?
5,000? Is that all?
Well, I mean, that's him, and also that's
politicians.
There's him, and then there's also there's that too. And I mean, you know how it is. It's not always the raw dollars. I mean, he could have gave $40,000 to Romney, but could have just gave a nudge and a wink to a staffer for Obama's campaign. Could have been you, Bridgemon.
Here's the biggest thing about a nonprofit to me. It doesn't matter if you're a nonprofit or not. What really matters is, does the institution thrive and desire revenue? If this institution behaves the way it sounds like it does, it is heavily invested in trying to reap as much revenue from the government payers and from the private payers and from individuals so it can fund very plush executive lifestyles and just contribute to the healthcare inflation for the rest of society, which, by the way, increased healthcare costs come out of people's wages. On a macroeconomic scale, it's effectively taxing your income, and that's just the plain economics behind it. And also, let Joey get away a little bit too much with this ridiculous high healthcare cost, innovation, rah America technology argument. However, according to the sources I've read, the Swiss in Switzerland, they have the same access to great technologies. However, they don't have to pay so much for it. And I really would like to see some data, because there's this claim that Joey keeps making that, well, America's where it's the only country that actually does any research and development with like medical devices. Show me some data that America is pretty much the only place that does anything good medically, and that there aren't other companies in Europe or Japan.
Well, I actually hold on. I actually do know that 67% of the world's biotechnology research is done here, and I think something like 40% of the pharmaceutical. But I don't have the research in front of me, although I can find it. But what I said isn't that we do all the research. I said we pay for all the research, right? So Switzerland has a lot of companies that are based there that do research, but the people who are paying for it are people in the U.S. because we're paying the higher costs of those drugs that is fueling the investment into the research and development.
I'd like to read. I'd like to read more about that. So I'd like to. Where can I read more
isn't
about
that? Isn't that common sense?
Yeah,
is it
common
right?
sense, Joey. Everybody knows that.
I mean, that's what I figured. I just wanted to make sure.
Yeah. No, it's definitely common sense.
Yeah.
No,
it's not so common.
All right, here's another gigantic thing that a lot of people don't know. How do hospital prices get determined? People talk about right wingers are like, oh, the free market in America, the free market. Well, we don't have a free market. What matters is how big the healthcare insurance company is versus how big the provider in that market is. So, if you have a city that has all of its hospitals owned by one company, then that provider has a lot of power at the negotiation table, because each provider has to negotiate with each payer, each insurance company, the entire fee schedule, and they negotiate all of these prices. If you have a lot of small healthcare insurance companies in a market, then that means the provider gets to say, well, that service went up 30% this year, and the insurance companies don't have the negotiation power. They don't have the market power to say no. In the converse, if you have a very fragmented provider market and then there's only one insurance company in that city, then that insurance company has more negotiation power to keep prices down. This has absolutely nothing to do with quality of care, has absolutely nothing to do with patient satisfaction. It is purely how big is the hospital company, how big is the insurance company. It's an absolutely ridiculous system.
All right, now I wanted to get back to something you were talking about earlier about how much these healthcare companies are donating to Obama. I thought it is just important to point out that among health insurance companies, when you look at the Plutocracy, they donated 3 times as much to Mitt Romney as they did to Obama. And 17 out of the 20 biggest recipients in Congress from health insurance companies were Republicans, because Democrats have effectively lost the health insurance sector as a part of their funding base.
What about insurance companies?
Insurance other than health insurance?
Well, yeah, health insurance companies in particular.
No, that's what I'm talking about. Health insurance companies have been beaten up by the Obama administration.
Poor health insurance. Hold on. How come when they decide?
I'm not saying it's a bad thing. I'm just saying that they don't like him, and they tried very hard to get him out of office.
All right.
Wow.
First off.
Wow.
All right. 2000. I just got this from Open Secrets. 2011 to 2012, the health insurance industry, which they're the highest industry other than the financial industry, the highest spending industry on our government other than the financial industry.
All right.
So, 2011 to 2012, they spent over $260 million. 33.7% went to Democrats, 42.3% to Republicans. I mean, that's what, a 5-point spread? Like,
overwhelming.
They overwhelmingly support Republicans. I mean, they're just so beaten up by Obama that they just can't help but giving him their lunch money.
On Open Secrets, health insurance companies have not totally abandoned Democrats, but they did abandon Obama. They donated 3-1 Romney versus Obama. So I just wanted to throw that out there. That, I mean, you want to talk about the Plutocracy in action?
It's the same.
They
it's the same as the financial
around getting Obama out of office, and they failed.
It's the same as the financial sector.
Yeah, the financial sector organized around defeating Obama too.
They'd prefer no regulation at all. But I mean, if they gotta have regulation, they'd rather write it. Mm-hmm. They don't care who's president as long as they own him.
Mm-hmm. I disagree with you. All right,
so and while we're talking about health industry campaign donations, Joe, did you notice who the top health industry donor is?
No, I didn't.
Well, it was an Adelson drug clinic.
Ah.
Oh, you guys heard of that before? I never heard of that. I never knew that. Yeah, Sheldon,
I've never heard of them, but
Sheldon
okay.
and Miriam Adelson
Wow.
have a Las Vegas drug abuse research and treatment company.
Oh wow.
And apparently, Miriam Adelson's a leading physician expert in drug addiction.
Oh wow.
And so they donated like way more than any other company in the health industry.
Wow.
They donated over
All right.
41 million between 2011 and 2012. The next highest spent less than a tenth of that. The next highest was Cooperative of American Physicians, spent less than 3 million. They spent 41 million in 2 years.
Hey, Joe.
I mean, you wonder why it's the race or the industry was skewed towards Republicans. I think Adelson's did it themselves, honestly.
Maybe for Democrats versus Republicans, but not on the Obama versus Romney.
Yeah, probably on Obama versus Romney too.
No, I disagree with that. I find that.
I mean, you can disagree, but Sheldon, he gives all his money to Republicans. He doesn't give any to Democrats.
But I don't think
and they are by
that
far
makes-
they spend more than 10 times as much than the next highest donor. So if they didn't skew it towards Obama or away from Obama,
Well,
towards
I'm
Romney.
looking at the math on
anyway,
Open
is
Secrets,
Is this money
and it's kind of implausible.
in the total amount of donations given by Sheldon Adelson? Or this just a separate?
No. That's what I'm saying. Like,
So his reach into our political system is not just his
it's not
direct
just him.
contribution.
Exactly.
it's pretty
wow.
deep.
And that's what I'm saying. Like with Jeffrey Romoff, the CEO of the University of Pittsburgh Medical Center, like he had his donations, a lot of them to Obama, but his company also donated too. So he might only donate $5,000, but his company still spent $1 million in lobbying, and his company donated over $150,000. So he might only donate $5,000, which seems like small potatoes, but his company's got another $150,000.
All right.
Plutocracy, you gotta love it.
I want to emphasize a little tidbit of plutocracy and ridiculousness. Sometimes there are these outrageous political myths that get started and they're completely false. We know fact checkers, PolitiFact, whatever, will take something and be like, pants on fire, this politician just straight up lied. So these political attacks get ridiculously out of hand. But do we ever draw connections? Do we ever connect the dots and follow the money and see if there's a specific industry that is funding and rewarding these politicians who go out there and make these outrageous claims? And I want to highlight one. Phil Rowe, a Republican from Tennessee. He took $90,000 worth of campaign contributions from the healthcare industry, specifically, according to a Washington Post article, were some foot doctors and some ear doctors. And one of the things he did, when interviewed, he said, yes, I would associate the term death panels with one of the things in Obamacare. So, death panels has been scrutinized.
This is
by
something
the
that pisses
media.
me off, this death panels term. Because if
Yeah.
there's anything talking about a death panel, it's insurance companies. Insurance companies deny when they deny that they're gonna. A doctor says, take this treatment, and your insurance company says no. That's exactly what these fanatics who think Obamacare is socialism. It's exactly what they're saying it is. But in reality, we already have that. It's not the government getting in the way. That's the corporation. That's the corporation saying, no, you can't have the treatment you need to survive because we don't think it's necessary. But the doctor does. So.
And that was one reason why the bill passed, because didn't every executive from every major healthcare insurance company get in front of Congress and they asked them, will you stop rescission? Will you stop rescission? Will you stop? And no executive said they would stop the policy of rescission, which is kind of arbitrarily cutting people's insurance when they got sick. So that was one good thing for Obamacare.
So
Obamacare
Joey,
didn't do a lot, but it did do some good.
All I want to know, Joey, is how much they're paying you.
I have a question for you, John.
All right.
If this if the medical industrial complex is so noble and cares about our health and all.
Oh, they don't care about our health. They're trying to make profits.
Oh, okay.
It just so happens.
It just so happens it benefits us.
It just so happens to benefit. Oh, okay.
We have a patenting system set up so that they are incentivized to do things that help us, and they get profits.
But that's what I'm saying. We're
it.
not, and you just said that. You said they're not. You said they're not in business to make us get better. They're in business to make us
money,
profit.
right?
Yeah.
So that means if it ever comes,
How is it
hypothetically, if they got to choose between profits and killing someone, they're gonna kill someone and take the profits.
Right.
Yeah, but that's the reason you have the FDA. Which I will say the FDA,
Wait,
I have a lot of criticism for the FDA.
Didn't
It's
the
the
head
Food
of
and
that-
Drug Administration.
Didn't the head of the FDA come from Monsanto?
I believe somebody there came from Monsanto.